My name is Krista Wells and I'm 46. I'm a very busy person, very active. I spend a lot of time at the gym, dog walking, I have a young daughter, and when I'm not doing all of those things, I'm a singer, so I spend a fair amount of time on my feet. Well, I had been aware of the fact that I had varicose veins for some time, largely because it's hereditary in my family, so I guess I knew what to look for. The telltale blue veins, which are slightly raised, I'd become aware of. But I think the real catalyst for me coming to the clinic was because when I was pregnant with my daughter, I had a very large vein which popped down to the top of my thigh and was very noticeable. And that just sort of spread down my leg over time, and I started to think, you know, this isn't really looking very good, and I realised I needed to seek an opinion on it.
The veins at the top of the thigh that Krista is actually referring to are vulval varicosities. Now, a number of women have these, and probably an underestimated number of people. Our data would suggest it's about 1 in 6 women, particularly if they've had children.
Obviously with varicose veins it can be quite tender, which is difficult when you've got dogs jumping up at you and children and all these sorts of things happening. So I think, yeah, obviously the tenderness was something that I was uncomfortable with. You know, in my mid-40s, you tend to think that varicose vein treatment is something that people who are much older than you will need, but that's really not the case. And I started to think about, you know, how I was going to stay as active as possible, you know, given that I had some soreness in my legs. Well, luckily for me, my GP was fairly well informed, I think, about some of the options locally to me, and she talked in glowing terms about the Whiteley clinic, which was good. But I did realise that I had a choice, so I came back and did some research because I wanted to make sure that I was making the right choice. And the reason I chose the Whiteley clinic was because I could see that they really were at the cutting edge of the industry, really. I really wanted to sort out the problems with my varicose veins, which I knew I was going to have to deal with. And it's one of those things that you just put off and put off, thinking, you know, it's going to be too disruptive, it's going to be painful, none of which is true, by the way. Well, as it turned out, the extent of my varicose vein problem was a lot worse than I had anticipated. But one of the first things that they will do here following your initial consultation is to do an ultrasound scan, which is fantastic. I mean, this is very new on the market, really, comparatively speaking. And they can actually tell how everything is functioning within your body. So I had an ultrasound which very clearly flagged up the areas that my veins were not working. It's quite amazing to see this sort of huge flash of red when you can see the reflux on the screen where, you know, the blood is not flowing directionally as it should. So following on from the ultrasound scan, which clearly pinpointed all the different problems I had, we worked out that really the problem was emanating from the pelvic vein area, which is something I hadn't thought about. So what we did first was to treat that, because if it's emanating from there, there's no point in treating everything else if you're not stopping the cause, the initial problem. So I had a small procedure called a pelvic vein embolization, which was completely painless, and that sorted that problem.
Just to clarify what we mean by pelvic veins, I've got a picture next to me showing the anatomy of the pelvic veins. Now, some of them drain the lower part of the pelvis, the base of the bladder, the neck of the womb, and areas like that, and the vaginal wall. And they communicate with the ones in the vulval area, and that's why they become implicated, particularly in pregnancy. These veins drain upwards, up into veins near the kidneys, and they're called the ovarian veins. All of these veins can be treated by intraluminal coils that can be put under X-ray control.
From there, we then went on to treat the veins in my legs through a variety of different procedures. It started off dealing with the main truncal veins with something called radiofrequency ablations, and then I went on to have something called phlebectomies and foam sclerotherapy, which are just different ways of treating the other veins that need to be treated in a slightly simpler way.
As in a number of our patients, while we were investigating Krista, we discovered that in fact she had problems up in the pelvis as well as in the legs. Now, the veins internally can react in exactly the same way as the veins in your legs, and they can be varicose as well. Now, that doesn't matter because not only can we interrogate these veins, we've also got effective treatments for treating them.
I really do feel as if I've been given a new lease of life. You know, I'm much more pleased not only with the appearance of my legs, but just in terms of my general energy levels, lack of pain, etc. It's been fantastic. I've also been indulging in quite a bit of retail therapy, buying some lovely new swimwear, which has been fantastic for me to feel so positive again, knowing that my legs look so much better. To say it's been life-changing would be a huge understatement. And I appreciate I sound a little bit evangelical about this, but it's absolutely true. The pelvic vein embolization procedure that I had has really just changed so much in my life. Prior to that point, I'd suffered from the most appalling irritable bowel syndrome, which in me had manifested itself through really terrible bloating. I'd had this for about 15 years, which is a long time. It had been very uncomfortable. Any sort of long plane journey, anything like that was just a misery, to be perfectly frank with you. And although it wasn't a guarantee, because you can never quite tell exactly what the results of the pelvic vein embolization will be, for me, I'm delighted to say it absolutely cured my IBS, which is just a benefit I'd never considered. I know that this has happened to more than just me, and that the Whiteley Clinic are tracking this, which is fantastic. But I think just to not have that bloating, to not have the discomfort, has just been unbelievably wonderful.
Obviously, this was a very welcome development that Krista managed to get a cure for her irritable bowel syndrome. And this is not the first time I've seen this. Whilst I'd be disingenuous if I suggested that all patients with irritable bowel syndrome need their pelvic veins treating, there does appear to be a link which is coming through more and more, but we need to do more research into this before we can say that the case is proven.
I'd definitely say go and seek an opinion. Don't delay. I think a lot of people will put this off. They have very antiquated notions of varicose vein procedures being very painful and disruptive and so on, and really it isn't. Things have moved on so far, and I think the worst thing I can say about all the treatment I've had, and I have had a fair amount of treatment to deal with my specific issues, I think the worst thing really is having to wear bandages and support tights for a short period after each procedure, which, let's face it, in the grand scheme of things, when you've got a fantastic pair of legs which are fully functioning and much more attractive aesthetically, I mean, that's a very small price to pay. So I'd say definitely go and get it sorted now. It's worth it. I'd like to say how impressed I have been with the team at the Whiteley Clinic. And I know I sound like I'm on commission. I can promise you I'm not. But I've just really been impressed by how professional everybody has been, at every level. I can't fault a single person here. I've been just delighted. And I think often if you're seeking medical treatment, you might be a little bit nervous and so on. But I think just coming into an atmosphere which is extremely well run, everyone is cheerful, optimistic, you're treated with intelligence, everything is explained to you. It makes the whole experience so much more enjoyable. I've been back many times now. It's almost like coming back to see friends, which isn't something I'd necessarily expected to have from the clinic, but I'm delighted that I have. It's made it just so much nicer, really.